The Baptist Cancer Center is launching a study to determine the barriers to multidisciplinary care for lung cancer patients. Their efforts earned a multi-million-dollar research award from a national organization. Doug Johnson has details on what they want to find out.
Diagnosing lung cancer can be a simple process, but finding the correct treatment can be tricky. It's a serious problem. 230,000 people will be diagnosed in the U.S. this year, but the survival rate is low. Only 17 out of 100 are expected to live 5 years. That's because many are older, frailer, and tend to have other health problems. The main risk factor is smoking, which increases the risk of stroke, heart attack, and kidney failure. Doctors at the Baptist Cancer Center are trying to improve the odds by bringing together the various medical providers in an effort to customize patients' treatment.
We've been very interested in this concept of multi-disciplinary care, and the rationale being that care for lung cancer is very complicated. It's very difficult, and if you don't believe it, all you have to do is look at the statistics. We don't do so well in providing care for patients with lung cancer.
The Baptist Cancer Center effort is getting a boost in the form of a $2.1 million research award from PCORI, the Patient-Centered Outcome Research Institute. Clinicians and researchers from the University of Memphis School for Public Health will look at multidisciplinary care compared to the usual standard of care.
Frequently what happens is patients kind of get care that is driven by what the individual doctor's biases, knowledge, limitations are. So if you have a problem and you see a surgeon first, chances are, you're going to get surgery in some form. If you have this problem and you see a medical oncologist first, chances are somewhere along the line, whether you need it or not, you're going to see some chemotherapy or somebody's going to try to push that on you, and things like that.
It's believed that multidisciplinary care should work better than that by bringing together various experts during the process to determine care. But while experts have been advocating the concept for years, it's still only being used in a few places.
There's a huge divide between what is deemed to be the best model of care and what actually happens.
The PCORI funding will allow the Baptist researchers to ask the question, why isn't multidisciplinary care more widely used? The research will include surveys of the doctors who plan and guide the care, hospitals that provide it, insurance companies that pay for care, as well as listening to caregivers and patients themselves.
But we're also going to look at hard things like what proportion of these patients actually got the right test at the right time? How long did it take to actually go through the key points in the care delivery process? How long did it take you to get to ultimate treatment?
Another aim of the project is to take the results and compare them to the Baptist program and make any necessary improvements or changes. Actions, results, and ongoing oversights will be used to help them be sure of where they are in the process of perfecting an excellent care delivery environment.
And how frequently was that ultimate treatment the appropriate treatment for that particular patient's particular cancer, both in terms of what type of cancer and how widespread the cancer was at the time treatment was decided.
A third arm of the project will be to then take the improved Baptist Cancer Center program and then compare it with the standard of individual or serial care using similar patients, and then look at the rates of survival to see which one of the systems really works best.
Because nobody has ever done this. Nobody's ever shown that this much touted, much advocated, but infrequently executed model of care is actually superior to doing it just the way everybody is used to doing it.
Because of the poor survival rate of lung cancer patients, Dr. Osero Giagabon hopes it won't take long to quickly determine which of the treatment standards works best. For Smart Medicine, I'm Doug Johnson.